Okay guys, we're going to go ahead and start our in-service. Today's 5/16/2025. We're going to talk about respiratory infection, okay? How your respiratory system works and why we get frequent infections through that system, okay? So just real quick, components of the respiratory system consist of nostrils, pharynx, trachea, bronchus, the bronchi, and the lungs, right? So your nostril, your nose, air goes through the nose, right? It goes into the pharynx, larynx, the trachea. It's those three things kind of controls where air can go to, where food can go to. And then the bronchi, right? The bronchi connects to your lungs. So a lot of times when you get an infection, it could be an upper respiratory infection, and that hasn't reached the lungs yet, right? So you might have some bronchitis going on, right? It's not as severe as like pneumonia. Once it gets into the lungs, then you'll have pneumonia, right? So these parts work together to bring oxygen to the body and remove carbon dioxide. Yeah. The primary function of the lungs supply oxygen to the bloodstream to remove carbon dioxide. So if you really think about how often you breathe, I mean, we breathe in, they say we breathe in, hundreds or not thousands of liters of air every day to filter out the air to come into your system, right? Provides oxygen to your blood. And one of the main reasons why the elderly is at high risk for infection is because your immunity is compromised, but also as you get older, the stuff that protects you, right, from infection as it passes through your respiratory system, it's not as efficient and effective, right? The cilia is kind of worn down. Maybe you were a smoker back in the days. Yeah, your mucosal membranes are not as effective and efficient. And again, your immunity could be really compromised. So this is one of the reasons why respiratory system is a very high likely of infection in comparison to other systems, right? Is because you're breathing in a significant amount of air on a daily basis and you're filtering it out. Okay, and it's an easy access for bacteria, fungus, and viruses that comes in. Respiratory tract, common site infection. I just mentioned that. So influenza, COVID-19, these are the typical infection, common cold, right? You get this. And so when we're looking at residents, how do we know if they have pneumonia? How do we know if they have bronchitis? How do we know if they even have an infection? It could be anything, right? What kind of symptoms do you think they'll have if somebody has these respiratory infection? Let's just say like a common cold. What kind of symptoms do we get for a common cold?
Runny nose, itchy, watery eyes, cough.
Yeah, cough, right?
Shortness of breath.
Well, that's pretty significant. That's pretty significant, right? So if you have somebody who has a significant infection, like COVID-19, that's can develop into like pneumonia and stuff like that, yeah, you're gonna have respiratory distress, right? Yeah. That's gonna pass through the bronchi. It's over to your lungs. You have scarring of the lungs, unfortunately, for long term. But you're gonna have fatigue, you're gonna have cough, you have weight loss, shortness of breath, as she mentioned. But these are the ones that are significant, right? But even if you don't have significant infection, right, in terms of respiratory, and you have a resident who's coughing, and these residents, because they're elderly and they're weak and they have other underlying medical condition, heart, kidney, and whatnot, any kind of compromise, respiratory, right, coughing, right? Like I made a visit last night to a patient, right, because I do hospice, right? I made a visit to an assisted living, yeah.
What? You do hospice?
Yeah, Elizabeth Hospice.
Since when?
No, I'm on call on weekends, but they needed me. They're calling me. Yeah, I've been doing it for a while, but I came back to them a couple months ago.
Oh, I didn't know that.
Yeah. So last night I went to visit this patient who was assisted living, right? And he was having shortness of breath, and it's because he had phlegm in his throat, right? And so he's trying to cough it out, and he's on oxygen, and not that he's having shortness of breath with an infection, but he's trying to get rid of that phlegm, and then because he's coughing so often that he couldn't breathe, and they had to give him morphine, and finally it kind of worked. But those are things that like affect the elderly, right? For us, we can spit this stuff out, right? For him, because he's weak, these things kind of sit and they get kind of thick, and then now you can't breathe, and you have shortness of breath. It's crazy. But people who also have like the common cold, right, that can develop into bronchitis, eventually pneumonia if it gets into your lungs. Okay, so it's really important to kind of watch our resident, how they're doing, because any infection, any compromise in terms of respiratory could develop into something greater later on if it reaches the lung, right? Respiratory infections are difficult to diagnose in the elderly. Symptoms may be subtle or mistaken for another condition, fatigue or confusion. So it's but here in skilled nursing, if any change in condition, we report them anyway. Hand washing is really important, right? Although we say, hey, you know what? It's the air that we're breathing in. You can still, have that stuff in your hand. Rub it in your eyes, rub it in your mouth, and so in any case, hand washing is still the number one way to stop the spread of infection. One thing is the difference between infection that happens in the gastrointestinal in comparison to like respiratory is that your gastric, your GI has acid to kill off all kinds of stuff, right? Where respiratory doesn't, right? We really all have mucosal membrane and cilia to protect us from infection. But still, hand washing is still really important because you rub it in your eye, put it in your nose, and you still get infected with that. Okay? It's really important to encourage our resident, the elderly, to vaccinate. Every year, not only for COVID-19 but also for influenza because that's pretty significant. And then ambulation exercise helps prevent infection. As you know, movement, increased circulation. That's really good for the elderly. Also, aspiration pneumonia is rampant, right? That can cause respiratory distress. So moving around, getting their lungs strong, expanding it. If you're just laying down and you're not moving around, your breathing is not as forceful. Yeah. So it gets weaker, right? So you're more prone for infection. But if you're and we only go for 7 minutes. But if you're walking around, you're breathing deeply, and so you're exercising your lungs. That's why when you have patients that come from the hospital, they have this breathing apparatus, right? Mm-hmm. So it actually expands their lungs. They're sitting down, right? It's an exercise for their lungs. You need to really be familiar with those kind of orders to leave residents. And then higher mortality for respiratory infections in the elderly. Seniors have weaker immune response and are more likely to have complications. So in any case, you just missed it. That's okay. This is a whole hour of in-service. Okay. I'm going to go over the questions.
All right, sounds good.
All right, let's go over the first question. Rebecca, why don't you go over the first question real quick?
The respiratory system is composed of the nostrils, pharynx, trachea, and lungs.
True. Yeah, that's true, right? Okay, Brandon. This is going to
Primary function of the lungs, take air and supply the blood with oxygen.
True.
Yeah, so as we were talking about, Brandon, and one reason why the respiratory tract is a high risk, is a good place for infection to kind of start, and it has a high risk of that, is because we filter a lot of air. We breathe in a significant amount of air on a daily basis, and the only way to filter out the viruses and bacteria and fungus that's in the air is the hair and the mucosal membranes. But the elderly who's 80, 90 years old with all kinds of underlying medical conditions, they might have a compromised immune system, and so they are higher risk for infection with the respiratory. Okay. All right, number 3. Let's do Raquel. Number 3.
The respiratory tract is the most common site of infection.
Yes, yeah, most common or frequent. Yes. And then number 4, Katrina.
Influenza is considered a respiratory tract infection. True?
Yeah, that's true.
Yeah.
Okay, I'll do number 5. Respiratory infections are difficult to diagnose in the elderly. It could be pretty difficult just because sometimes they might not exhibit. They could be just lethargic, So yeah, it's pretty difficult in any age, I think. 6 symptoms which might indicate respiratory infection are fatigue, cough, weight loss, mild shortness of breath. Is that true or false?
True.
That's true. Okay, and then we're gonna go in the back over there. Who's in the back of them? Don. Don, you're trying to hide from me with your
Washing hands. Washing hands does not help prevent spread of respiratory disease. False.
That is false. Yeah. And then influenza vaccines are recommended for the elderly. Yes, we do recommend that. That is very true. And then ambulation and exercise are very important in preventing respiratory infections in the elderly. That's true as well. And then we're gonna do number 10.
Mortality rate in the elderly is higher due to respiratory infections, true.
Very true. Alright. Does anybody want to share anything? I know that's pretty quick, pretty painless. What else did we not cover that you feel is important that you are willing to share? Some of you guys are thinking to become a doctor. Come on. We need you to. What else, guys? Anything else you want
We
to share?
still have the tests for if they have flu too. We have a little like.
Yeah, we have that.
still
Yeah,
have
the
that.
COVID, influenza. Yeah, we have those. So if you have, symptoms. Yeah. Okay. Well,
Thank
that's
you.
it. Thank you very
Are
much.
you gonna have one? What's your next in service?
It's probably gonna be next Wednesday.
Oh, yeah, you guys are.